CNA Practice Test Updated 2025 Hardest Nursing Assistant 25 Questions Answers. Question 1. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 2. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 3. How should you identify a resident? Ask their roommate, check their room number, check their ID band, call them by name. ID band is the standard identifier. Question 4. A resident is angry and shouting. You should shout back, leave the room, stay calm and listen, call security immediately. Therapeutic communication involves staying calm. Question 5. A resident refuses a bath. You should force them, respect their refusal and report it, call their family, tell them they smell. Residents have the right to refuse treatment. Question 6. A resident is choking and cannot speak. What should you do? Wait for help, perform abdominal thrusts, offer water, hit their back. Abdominal thrusts Heimlich for complete obstruction. Question 7. When a resident is on NTO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 8. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 9. A resident falls. What is your first action? Help them up, call for a nurse, move them to bed, give them water. The nurse must assess for injury before moving the resident. Question 10. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 11. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 12. What is the first step when discovering a fire? Rescue residents, activate alarm, contain fire, extinguish. Race protocol starts with rescue. Question 13. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 14. A resident is in isolation. What is done with their linens? Double bag them, wash in the sink, throw them away, shake them out. Double bagging or special handling per facility policy. Question 15. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap. Below the bladder to prevent backflow/infection. Question 16. Which of these is a sign of skin breakdown? Redness that doesn't go away, tan skin, dry skin, freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 17. When dressing a resident with weakness on one side, Dress weak side first. Dress strong side first. Dress both at once. It doesn't matter. Dress weak TW and dress strong. Question 18. What is a living will? A bank account, legal document about end-of-life care, a birth certificate, a list of belongings. Advance directive for medical wishes. Question 19. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 20. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard.